Three.
Hi, my name is Jonathan, and I'll be illustrating the sensory supply of the hand. Alright, so the sensory supply of the hand is by three important nerves. So the very first one is the median nerve, and I call the median nerve the motor of the forearm. And the next important nerve in the palmar surface, so you have the palmar surface and you have the dorsal surface, is the ulnar nerve. I call it the Holdner nerve because it holds things as much as possible. So you have median nerve and ulnar nerve. The next important nerve in the hand is the radial nerve, and it's behind. Now, with that said, let's look at how this works out. Now, the majority supply of the hand comes from the median nerve. Usually, most books will describe it as 3.5. So, if you zoom there, can you see that? So, in the palmar surface, 3.5. Can you see that? It's 3.5, like that. Is supplied by the median nerve. The rest of it is supplied by the ulnar nerve, so 1.5. Good. So that does the supply of the palmar surface. So we'll go to the dorsal surface. Remember, I've spoken about the radial nerve. So the radial nerve generally supplies the radial 3.5. So you do that. You could do that somewhere like that. And the ulnar nerve or Holdner nerve would supply the rest of it. So let's go. So you have the radial nerve supplying the radial 3.5 thereabout, and you have remember the ulnar nerve, which is red, supplying about the 1.5. However, the trick here is the median nerve, which is blue, supplies the tip. So supplies the tip that way. So to quickly recap, three of the supplies of the hand comes from the median nerve, which is blue here, the ulnar nerve. So the median nerve on the palmar surface will supply the radial 3.5, and that's that. And the ulnar nerve will supply the ulnar 1.5. Now, when you go posteriorly, the radial 3.5 will be supplied by the radial nerve. And one of the things I tell students is the radial nerve is right back, like from the name is right back. So it supplies things in the posterior. The ulnar side is again supplied by the ulnar nerve, isn't it? However, the tip on the posterior aspect is supplied by the median nerve. So I hope you found this video helpful, and feel free to ask questions.